Good afternoon to all of our viewers, and thank you for tuning in to our virtual program for this week, Self-Care and the Importance of Mental Health During COVID-19. I'm very excited to welcome back our honored guest speaker, Ms. Thupeng, to this week's live session with the American Corner. Ms. Thupeng is a social scientist who majored in sociology and development studies. She is an assistant researcher and a community outreach officer who is passionate about issues relating to mental health. Ms. Thupeng, welcome to our session today.
Thank you guys for having me. Thank you.
And again, I remember the last time when you were at the AC, you had offered our patrons to actually help them out, that if they had any issues, you gave them your number and they could call you. And I thought that was the sweetest thing. So thank you for always being open to assisting people with the mental health challenges and being there to counsel them. To get right on to our first question, may you please tell us a little bit more about your work and what inspired your passion for issues relating to mental health awareness?
Okay, I'm a social scientist. I majored in sociology and development. I deal a lot with people from all different backgrounds. I studied their behavior, their interactions, and how they do things in different kinds of ways and stuff like that. So I think that is where my love with working with people started. I kind of fell in love with knowing people and just how they do things and things like that. That is where the love started. And then, okay, so my mental health thing or love of person really started with myself. I could be going through some things, feeling all these emotions and really didn't know how to locate them, how to say I'm sad, I'm happy. And it really was when this whole mental illness started. You hear people talking about, oh my God, I'm so depressed. So it kind of got to me and like, are you depressed? And then I started going online, trying to find what is it that I'm feeling. Am I depressed? I have anxiety. Oh, what is happening? I think that is where my passion for mental health really grew, because I wanted to know what is wrong with me. And I looked online so much. I spent so much of my time online trying to really think to see if I'm depressed or anything like that. And from there, I started talking to other people who did social work, who did psychology, really trying to get the hang of my feelings. And when I did that, I really figured, okay, no, babe, you're okay. You don't have depression. You don't have. So I wanted to see somebody who has depression. I wanted to be in contact with somebody who has mental illness, to see the difference between what I was feeling and what they feel, and really know the difference between mental illness and stuff like that. That is where I think my passion started. And from just interacting with people from all walks of life, and how everybody just tried to really try to locate their own feelings and how they handle themselves.
I think you telling your story really, it's very evident that it stemmed from like a person, like the passion that you have is like, okay, this must have come from a very intimate place. And thank you for sharing that with us, which brings us on to what do we mean when we say mental health? How would you break that term down, say, for someone who is not familiar with the term?
Okay, so I'm gonna start first by saying mental health is a broad term. Mental health is ka Sesotho ha ke leka ho tlisa Sesothong ke bophelo ba kelello. So bophelo ba kelello ka ba bophelo bo botle kapa bo bobe. You understand? I'm gonna break it down. You try to go get your nails done for a little later and be attractive, right? and then you put on rings and stuff like that. Same thing goes to our mental health. With our mental health, it's you have your mental health, you try by all means to keep it really healthy. You go out, you exercise, you do things, you read. You know when you don't read often, you end up with when you're discussing something, it's because you didn't prepare. And
Yes.
how high staff. So if I forgot that receipt man more ring, lawyer how in a liberty. Mental illness. There's mental health and there's mental illness. There's mental illness, some people refer it as mental disorder. So another what we are going to focus mainly on, it is mental health well-being. Mental health is how people think, how you feel, how you behave. It all depends on whether your mental state is good or is not good. You get it? You understand? So that's what you say, like people what you do, to maintain it to being really healthy. It is the state of well-being.
Yeah, sorry. No, Neketore, it's interesting that like we sometimes think, okay, these are English terms like mental disorder, but you know, and I think maybe we can understand it better. Okay, maybe depression might be like a far off term for someone to understand depression, but how so okay, then it kind of brings it closer to home. Okay, so then how then how can we assist you? So I really appreciate that you are also dealing with it from the context so that like you're saying, so that it becomes imperative for them to say, okay, I need to deal with my mental health the same way I would deal with my physical health, the same way I would deal with, you made an example, your nails, or you want your nails to look beautiful. Why wouldn't you want to, you know, in a good state? So happy on that note, in the context ya Lesotho, also I want to welcome Tandisha Banalima Sechaba Moshweshwe to our Zoom session. I will be taking your questions towards the end of our chat, and Nikiboni, the questions are already coming in. So in the context of Lesotho, how do you feel we perceive these issues? Are there areas where Basotho generally do well in understanding the issues? And are there areas where you feel like, okay, maybe we don't quite understand the issues that are mental health? And please elaborate by like really making us understand now, why is it important? Like, why is it important for us to really understand these issues?
Okay. Excuse me. Ke tlo qala pele ke re bohlanya. Kwa hlanya eng? Se o mutsi hampe. Just know. Oh, that is where we are as a nation when it comes to mental health illnesses and issues. And we don't see that these things are mental health illnesses. Depressed. Nobody traumatic, anxiety. But rona re le Basotho re mona mo ntse ke hlalosang se re ntse re bona mahlanya, re ntse re bona motho a dimutse, and we don't even want to learn because we don't even go to the person a dimutse re motse, are you okay? What's happening? Last time you were so excited, you were all over the place. What's wrong? We don't do that. Is overwhelmed with feelings, they don't know what to do. The worst part of mental health issues and illnesses is that at the time cannot even locate the feelings, does not know what is wrong with them. When I traumatic, That is where we are. That the more mental health issues and illnesses. We don't even want to know. Okay, now what is wrong with this person? Why are they mood? Why is it snob?
I think the other thing is lack of empathy. Something that our community is aware of, or maybe it's grief. I know is a very common thing that we deal with in our communities. People die for various reasons, but hangata Lesotho monana, grief is something that we deal with a lot, and that we kind of don't understand when someone is going through a grieving period, and they're acting in a way then we're judgmental, but we're not really trying to understand the source of now, why is this person behaving this way? Even something as simple as a relationship or divorce, or we know this person's relationship is not going well, and we see the impacts that has on their on their well-being, and yet empathy for one another. So I'm glad that we can have this conversation in the context of now, what are we seeing on a daily basis? Do we have enough institutions in the country to deal with mental health challenges, and are there enough efforts that are being made to address these challenges?
No, we don't. We do not. We have one, everybody that knows it, Moya Masha. We emphasize Mono, Moya Masha. Mental hospital. And it's so stigmatized. Mono ke mashani. How only depressed or someone over said mono, or so qualified loyal fast when we are Masha. So we don't have enough institutions as Vasoto. Also, there was a time I was working with one nurse. I think she's a therapist. I had to refer some of the people I was working with to her, and she was booked. She was fully booked. She used to work at Quinto. I don't know if it's good for me to share her name, but she's forever booked, fully booked. If she goes there and she wants an appointment, or I referred some of my clients there, I remember we would have to wait for a month or two just so they could have first appointment. That was a government person, and we really do not have enough institutions or people that could help us with people that really suffer from mental illnesses. We don't have enough institutions or help whatsoever.
Would it make sense then, like what Batuba studying, like who are the relevant people that could take on this call to say, listen, we do have a serious issue in terms of how we deal with our mental health. The first thing that does not go through your mind is, okay, what professional can I call in order to get help? I think we always look towards, our friends, our relationships, our family members, but I think we seldomly look at like actually getting professional help. What people would you encourage to take on, this challenge? Can you make yourself available to Bacha, especially Baba? So to Libato, to be honest, to say, haibe only psychologist, haibe only, even if it's like on a, setting up a private, or a virtual, we can meet through Zoom, we can meet through WhatsApp. Which people would you identify as the most relevant in terms of dealing with mental health challenges?
Excuse me. First of all, how do you know that you're depressed? Because my thing is, I'm so against people that self-diagnose themselves.
Yeah.
Oh my God, really depressed. How do you know that you're depressed? A lot of us really bad. We self-diagnose ourselves. You don't know what is wrong with you. You're just having one of those days where you don't even want to wake up in the morning, but depressed. Oh, anxiety. The fact that you don't know what is wrong with you, I cannot say, oh, no, let it a social worker. I cannot say go to a therapist. I cannot say go sit down with a sociologist and try to tell her all the things you are feeling so that they identify the fact that we do not know. We you have just a week of things not going your way and also depressed. You're gonna have bad days and good days. Do those bad days mean that or depressed?
Which is what because Tandisha Bana was saying, if I'm sad today, does it mean I have a mental health problem?
No. Go na le matshwao a mangata hona ho a tlotla a re tlo qetella re motho no bonala le depressed. Ha o tlotla o tshaba tsatsing lena o e be ho sa o kwatile le serere no motho na isona le depression. How tlotla overwhelmed by something that just happened. Every bonang kaofela okay, this is so overwhelming. E be re go na le anxiety. You get it? So hona le matshwao people should be aware of that goes on and on and on. Only for 2 days. Out of the blue. What is wrong? It's out of the ordinary. Yes, seasoning. Also, she's acting so unusual. They're out of character. Or even depressive and anxiety because oh my god, she's so crazy. That is that. But getting back to your question, there are social workers. I have a friend of mine, Dimpo Moledi. I know she's willing. I have another friend of mine, she's a social worker. Dimpo Moledi are willing. If we have somebody who needs to talk to someone, I would refer them to Dimpo Moledi right away. They will talk to them. They will refer them to places where they need to go. Also, there are therapists, there are counselors. The social worker can really, the sociologist can really identify by interacting with people. They have mental illnesses. They can interact with them and really come up with what is wrong with them, or refer them to the social worker, to the psychologist, to the counselor, that are willing to talk to them.
Tandisha Bana is asking, but they are introverts. Would you say that such behavior is an issue? People that don't generally like being out with other people, but who socialize as much. Like, where do you draw the line between someone ailing introvert and someone who might be, at the brink of experiencing a mental health issue? Let's say depression, for example.
It really takes me back to oh my god, like an introvert. Introvert is no, you just have one of those moments where you don't want to talk to other people, but really there are other people, but you said something about the mental health illnesses, mental illness, good. An introvert, o tlo bona gore ke motho a normal le ga gate ya batho. Motho a depressed wa kutsi. Introvert di a hlapa, motho a depressed ha hlapa, doesn't care. They do not care about anything. How motho a modimo o na le exam ya tla. How ba tlo bala? They don't care. Ke motho a depressed. High anxiety, but one and the anxiety are outstanding. Ke motho out of the blue, usa trilo to second training. Yes, to somebody ena essentially lens in a satana wing. Usabana mutino abnormal. Also, they have the outbursting in Salasala, and they're excited, really bipolar. I've been fortunate enough to actually be in contact with somebody and bipolar, and I realized no, having a bipolar, bipolar, because born 2 minutes there, 2 minutes are crying. This is an illness. So born, an introvert doesn't really like people that are in that space. They don't talk much, but they're so depression, people have depression because I think you're not the most common one. Most are depressing. They don't care, but they want that. When you try to reach out to them, they really want you to really see through them, to really see inside what they're feeling, because they don't even know what is wrong with them, but about depressed. So they want attention, even though attention is really pulling back from the crowd and really isolating themselves. And it doesn't make sense. You get it. I want to think you are, but I'm gonna go away from you.
Yeah. So what I know, there are people that go through, maybe let's say a traumatic experience, right? And you can see, okay, this is really starting to affect me. But then again, our reality, this is something that we always say, right? So what do you say to someone who recognizes, okay, I am going through a bit of a challenge here, but hi, ha ke nana o dula fatshe ke bua mathata ka le motho e ke sa mo tsebeng a tlotla now ha ke qeta bua mathata ka o sa ile ho motho e mong o sa buile mathata ka. I think there are people that generally have that fear that if I approach, a social worker, a therapist, and open up about what I'm going through, I'm at the risk of having my issues known by everybody.
When it comes to mental health issues in general, because if how next thing you know, Seriti is all up in your business, how wada, things like that. And it's so unfortunate that we cannot even trust our own people. But when I talk to someone, talk to someone you trust. It's about your business, but it is always so important to talk to someone. This is why just a toll free and thinking more so at the end of the line there's somebody listening to her. It being a therapist, it being a friend who's not really a friend, just an ear to hear you, because it is so important to actually talk. How you are not okay, reach out to someone. We always say reach out to someone because it has its own disadvantages, but it's important to speak up. Speak up how when I don't even know what I'm going through. I think
which is what Thandi was asking now. So at what point does an individual have to decide to seek help, like to notice that there's a problem? When should I approach someone and say, okay, give me it?
The minute you feel like you're not okay, the minute you sit down and say, I am not okay, tell someone. Those feelings, just reach out. Reach out to someone first and tell them, I'm not okay. But in somebody you trust, this was us raising awareness and mental health issues. So I'm telling you today, when somebody goes to you and says, I'm not okay, try to talk to that person. Because they're not going to tell you what is wrong. I'm not okay. Listen to what they have to say. They want to end their own life. And when being an ear, you don't know. Just stop asking questions. I'm not okay, and I haven't been okay in so many months. I haven't felt like myself. I haven't done this and done that. Like me saying, when I'm pay attention to people like that, because I had a friend once who was so depressed, and unfortunately he ended his life. He said to me, I tell him I love you so much. He's like, hey, you guys are acting like I'm already dead. That was a few days before he ended his life. That I paid attention, but that was just like that. You guys are acting as if I'm already dead. But if you pay attention, it's little things suicidal people say like that. So guy when I think it was so mobile. Also raise a flag to no also bua le batho bo tlameileng go bua le bona ba bagolo ga ba o le motho a monyane kapo o atanela motho eno ka tseleng jang, because motho a depressed and people that want to end their life ha tlo tla ke tlo ipolaya o tlo jwetsa ga thetse gona go ga ke bona go baneng ke tlameya o phela ha tlo tla go wena I want to die. When I want to die, yes, over that attention, I battle because you don't know how you will feel if they end their life, if they actually die. So kids I had a friend of mine, Mona, comes to me and says to me, I need to talk to someone. And I was like, what's wrong? It's like, I feel like a lot of things are not going accordingly. I've run out of plan A, plan B, plan C, but I really don't know what to do now. And I was like, I want to talk to someone. It's like, yep, I want to talk to someone. Like, should we find someone? And I was like, yeah. And we did that. And they went to see someone else. And I was so busy and they reached out. It's not everybody who does that. Some people, yes, they do that for attention. But you'll never really know when are they sincere. So it's always best if you reach out and help them.
In the last half of our chat, I want to talk about how do you think the COVID-19, I mean, it's been a year and April, May, June, 3 months since our first initial lockdown. How do you think COVID-19 has affected, people's mental health in general?
COVID-19 people have lost their jobs. Some their businesses, some they've lost their loved ones. So I thought I can as an fellow saying, but we've gone through so much emotionally, physically, and spiritually. Some people with that spirituality, some haven't been to churches, some haven't been to the mosque and stuff like that. It has done a lot. And I can tell you, with me personally, I stopped watching statistics that COVID and how many people are infected, how many people, stuff like that, because I felt like, okay, each time I see that Kuka was so overwhelmed. And I stepped back and said, I'm going to stop. Regarding COVID. I remember when our country started vaccinating people. I was like, I don't know. Because I couldn't. It overwhelms me. So it takes me back to what to do to keep your mental health healthy, if I should say that. Step back in things like that. When you feel overwhelmed like I felt, you step back. It's okay how infected. It's okay how it's really okay. It's okay how decide I'm gonna cut these people. I feel like they're toxic. Some type of way. It's okay. It's really important to actually know how to take care of your mind and your mental health. It's okay to know I'm getting overwhelmed, I'm getting scared. It's okay to step back. And a lot of people do that.
No, continue.
A lot of people do not know when to draw the line, even just stressful workplaces. They don't know how to say, okay, that's not a home. Because I don't feel okay. People don't do that. They don't know how to step back from situations.
So the other thing that's interesting is, I guess with COVID-19, we'll kind of relate it with the state of our economics and the state of maybe political stability in the country. That Kandishaban is making an example who in Scandinavian countries, they have, some of the lowest mental health problems simply because the socio-economic and, political stability is very different from what we experience. And then she also made a point that we now see a lot more people with mental health illnesses, but like just in the streets who are just loitering, if for lack of a better word. And like literally, like I think 2 weeks ago, there was a lady who was seated by FNB and she was wearing a bikini. And this is like in morning hours. She's wearing a bikini. She speaks well, she's most likely educated. She looks like she's bathed. And she's basically and the people around were just looking at her like bye. They're just surrounding her, looking, somewhere laughing, now what's going on with this lady. And I called the police and I'm like, we're experiencing something that's odd, because when we were growing up, like okay, okay, maybe there's about maybe 2 people but I don't think it was at the level at which it is now. And I am kind of wondering now, with our economic issues and now with COVID, is that something that we're going to be seeing more of just because of the instability that we have with batho ba losang mesebetsi, dikolo tse kwetsweng,
Yep. I could say formally and informally. Batlo ke kopa ho sebedisa lentswe lena la tlhalagate, batlo hlanyetsa ka tlung, batlo ba di-press ka tlung, re sa ba bone. Ho na le be re tlo ba bona hohle mona mo re tsamayang. Ke tlo tla ke etsa mohlala, even though it's not really a relevant topic, but we can just see by the number of sex workers tse se re di bona hana batho di eketsehile. Ntho nngwe le nngwe e mpe, if I should say that, e tlo eketseha because it means someone has to go hustle. Halo hasela valo olo hasela ka ha. And and they cannot even call anyone. Until iba etsa. Ke man mo atlo sella beteng. O tshaba hore o lapile. They don't have anything to eat. Now those are some of the leading things to depression and just mental illnesses. Because also, like I said, people do not talk because they don't know who to trust anymore. So but financial economic problems and stuff like that, it's gonna have leading factors into mental illness. You cannot go tell a man who's the head of the family, who's a breadwinner in his household, to go tell somebody that they cannot provide for their family. What does that do to their pride? What does that do to them? So they end up being depressed and not even telling anyone. So even stress and depression and mental illness, it's a mafu a mang. Antale siko. O so bona motho a sa tshwere ke mala, a sa tshwere ke kana kon ke stress ka le stress fela. It's a mere stress, mental health, and they're so severe. So countries with less political instability, with good economic wealth and growth, they're better. They're better in regards to mental health, because you, among other things, you don't have to worry about what you're gonna eat, or the government just whoever is in power today, tomorrow they're not in power, things like that. We've seen our country changing prime ministers in the middle of the pandemic. What did that leave us? The uncertainty it left us with. We didn't know what is going to happen tomorrow, what's going to happen today. We still don't even know. And it's so unfortunate that our country is going to, we're going to have national elections next year, and ballots and stuff like that. In this COVID, you understand? It's this political instability. Even it doesn't even care about COVID.
So the other thing, there's been more conversations around, I guess, with young people. So we're young, we want to get employed. People have graduated from university. They're looking for that first good job, and then when they get there, the reality is it's not so fun, right? It's not so fun. You have to deal with okay, these people don't really listen to me, kapa and so my question now, what advice would you give to just people in the work environment, and especially in HR, now, like, what should we do about mental health in the workplace? Like, is that a thing? Like, and also the observation it's a how, and some of the conversations that you've had, now what's the culture yaba so truly mental health in the workplace?
It's still more or less the same. People are still regarded as traumatic, as snobs, moody, and stuff like that. But I think it is so important to have a wing in the work department where people can just go and really talk to someone, because some people work in really stressful workplaces. They work under so much really bad conditions, if I should say that, and they need people to talk to, not your boss. It shouldn't be somebody related to the workplace, because I feel like if Seriti or Seriti, and I have to tell Seriti all the challenges I'm getting, I'm experiencing from work, and it shouldn't be like that. I feel like they should bring somebody from the outside who doesn't have fun, who's just there to listen to the employees and the employers as a whole, to really understand the challenges employers are getting, how can they best solve those things, and really what to do and to move forward, because mental illnesses and issues are really there and they need attention. Sometimes people really cannot handle the heat they get from the workplaces, cannot handle the stress. So in regards to the workplaces, it's really tricky, because you feel like this is a very toxic work environment that needs the money.
Yeah.
Wake up every day and go to work and go home and cry and don't know what to do, and really disconnect with your family members. Some people work 6 days a week, they only take 1 day off. and they miss out family relatives. They don't even go to family functions because they're forever at work. Such places should really have things that can really make me look forward to going to work. They should have as many things as they can that could really make the employees really comfortable at work. Ask them, sit them down.
Because also now there's the hybrid, you're working from home and working, actually going to work. And I know we've been close for like a year and over a year. And as a mother, like one of my challenges in the beginning was, oh my God, like, so now I have to work from home, but I also have to be a mother. And how like there's no time off. Like as long as you're home, you're a mother. And I think that those are some of the things with regards to COVID that employers need to kind of, gauge who feel the employees how the opportunity to work from home. That's a good thing, right? Because then they don't have to go out and, have the risk of contracting COVID as their interactions are minimized. But also, what does it mean for women and what does it mean for mothers? Bana can go to school. So how do you high high your wife, your relative, if you live with your relative, and that can be a lot. Like I remember like there was a time I legit had to like hoosa myself because I'm like, this is a lot. So yeah, having those spaces in the workplace where, and I mean, I'm fortunate to have, a work environment where I can say, okay, like I actually I need to find, a babysitter. I need to do this. I need to do this. And I feel like more work environments should be as accommodating, especially to makeup or, to women that have other responsibilities outside of just being workers.
But unfortunately, I didn't get the chance to work from home. But apparently it is so stressful. I learned that people work longer hours. They don't even take breaks. So it goes back to one of these days, you're gonna just sit down and really collapse because you are tired. In as much as you're working in your bed, in your PJs, you don't even care how you look, but what are you doing for yourself? You're forever in your house. Your boss is calling you at 8 p.m. because they want you to view what email and reply to certain emails and stuff like that. What are you doing to yourself? For yourself, to yourself, to your body. Take those breaks. Everybody has a break. There's a tea break at work. Take them. When you have a chance, go jog. When you have a chance, go jog. Interact, meet your friends, go out for drinks, go out for lunch, get out of the house, because that, you staying in the house for that long is also one of the factors that leads to depression. Next thing you know, you start working from home, you realize, you open your eyes and you see, hi, Bo. Did my neighbor build that? Oh, my neighbor has a dog. Oh my God. Oh my God. You understand. And you so much. You're not even aware that life is really going while you're busy. In focus with your work, working from home. Take a break from everything. Take your annual leave days just to recoup and get back that thing. It is so stressful. Apparently, I can't speak much of it because really, I
know.
It's a yeah, I understand you're a mother and you are a wife and a colleague to some people. You need to help them with certain things, but at the same time, what are you doing to yourself? When it comes to mental health issues and illnesses, you need to be so selfish at times. You need to really think of yourself, because the next person is not going to think about you. Is not going to accommodate your needs. So you need to actually say, I'm tired, I'm hurting now. And really state your facts that I've been working from this time, which I do not encourage. I encourage people to really take breaks, to exercise, to take full meals. I remember a friend of mine had alarms like when we were hanging out. Like then I was like, I made an alarm so that I know it's lunch. I can go eat.
Right.
Okay, yeah. Your
Yeah.
boss is not gonna stop working, hey, but
No,
you
it
need to.
really doesn't. It doesn't. It doesn't. So what do you see as the future of mental health practitioners in the country and your wish for the general public when dealing with mental health challenges?
There's such a gap in the for mental health practitioners in this country. First of all, there are no resources, and I feel like the government, it's not the government, it's our government, we all know what we're talking about, but I feel like the government should really, really look into mental illnesses, and really, there's so many people I know that get professional um, social workers, clinical sociologists, therapists that are not doing anything because there are no jobs. And I feel like if the government would really close that gap where the people are not working, where they really employ them, and then I know where I can refer somebody with who is struggling mentally. I can say, go to someone, they will help you. Go to so and so, they will actually find someone. It will be so much better in raising awareness for mental illnesses and mental health in
the country. And I think we've lost Seriti for a little bit. But yes, we are approaching the end of our session. And I just wanted to check if we had any more questions coming out from Facebook. So I'll just go to all comments. There's a comment from Mutumoholo Khupa. If I might add, mental health a person always has, but mental illness comes and goes. And then Tato B. Holwane says this was a much needed conversation. Thank you, ladies. Buitimpua says, I'm proud of you, sis. So, Seriti, you must know who that is. Yes, now you're back. I was just going to the comments because you cut a little bit, but I think one of the last things that we were gonna discuss is, okay, so okay, and she's gone again. So I will just go back to our comments. Makalo Marumo says, ke nnete taba tsenana. Poloko Mogele says, love this. Shwani Maleshwane Khutlang says, wow, I love this. I am really happy that we're getting such positive feedback from our viewers, and I think it's also an opportunity for us to maybe continue on this conversation, because I feel like we've covered just so people have a general sense of what we're talking about when we talk about mental health. And I think there's greater opportunities. I know Tandisha Bana had great insights. Masichaba Mushosho also has, you also mentioned her as one of the people that is available. So I think maybe we it's an opportunity for us to say, let's continue the conversation, let's engage more people and hear what their thoughts are on maybe specific issues. You spoke about bipolar disorder. Some people don't know bipolar disorder na keng. And I think maybe it's an opportunity for us to have another conversation and kind of delve deeper into, when someone says I'm depressed, what do they mean? When someone says I have anxiety, what do they mean? When schizophrenia, what does schizophrenia look like? What's bipolar disorder? So thank you so much for joining us today. This was really informative. I've learned so much. And so I just want to ask you a personal question, Orena. Where do you see yourself in the next let's say 5 to 10 years?
Where do I see myself in the next 5 to 10 years?
Yes, professionally.
Professionally.
Yeah.
Okay, I want to dive much deeper into the mental health and mental health issues. Really, I also want to do clinical sociology and really just focus on mental health. And that is like in the next 5 years. In the next 10 years, I see myself working alongside Maschaba Mosheshe and Dimpho Moledi, really trying to help people with mental illnesses in this country, trying to bring change. I think we want to do our own thing where we really can help people with counseling, referring them to right places, really just sitting them down and making them aware of things, of mental health issues. I think that is like me and things I'm saying.
We do know that we have a Yali program.
And I was gonna talk to you about that, and yeah, we're gonna
yeah,
talk. We definitely
are going to talk about that. But for some people that don't know, the Young African Leadership Initiative is also located at the American Corner, and this is for young, Basotho leaders that are interested in changing their communities and continuing such conversations as these, in how we can better improve ourselves professionally, academically, and also how we can improve our communities. Seriti, do you have any last thoughts that you want to share with our viewers?
Okay. One thing is, guys, mental health is real. Mental illnesses are there. We really are suffering as young people. We need so much help. We need people we can talk to. Mafu akela look into the thing. Isn't what I'm like we are used to saying. And be a better person and listen to someone next to you when they're trying to talk to you. Also talk to someone. There's so much going on. There's political instability, really high rate of unemployment. There's other issues I can't even really talk about right now. Try by all means, please reach out to people, talk to social workers. I have people here I can refer you to. If you need help whatsoever, even after this conversation, please call me and tell me you need help. I can refer you to my 2 people that I trust so much with my own mental health also. I reach out to them from time to time. I was like, Manaka, what is wrong? This and that, what should I do? Even just simple things as conflict resolutions. There are people who do not know what to do when they have conflicts in their families, in their relationships. These people are here to help you, to make your life easier.
And how can people get in contact with you?
Please, okay, I do not have any social media, but I have LinkedIn. You can really try to connect with me on LinkedIn. I am Seriti Thupeng. I'll connect, we can talk, and then I'm going to give out my numbers. My numbers are 56532652. You can call me anytime as long as it's related to mental health and mental illnesses. And I will refer you to Maschaba and Dimpho.
Okay, thank you so much. I think what I can also do is find your LinkedIn profile, and then I will add the link in the comment section. Thank you so much again for joining us today. This was such an informative talk. I really, 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 really want to have more of these conversations with you. I want to meet the people you work with and the people that you brainstorm with, because this has been so informational and just so transforming, to be honest. And again, thank you to our viewers for tuning in today. Thank you for commenting. Thank you for liking. Please remember that you can always go back to this chat. If there's someone that you want to tag, we would appreciate it so much if you could get the word out as much as possible. Thank you to American Corner again for hosting this awesome session, and see you soon for our next virtual program. Bye.
Bye.